Good afternoon, good evening, or even good morning, depending on the time zone where you are and where you are watching us from. We are so happy you made time to be with us. And of course, this is Julius Mbaluto Live, and I'm your host, Julius Mbaluto. We are coming to you from the heart of London to wherever you are. Today's title for our discussion is COVID-19 pandemic or even COVID-19 vaccine nationalism. And this is our focus for our subject today. We are going to talk about it. We are going to explore it this very much as you join us. Wherever you are, feel free to connect with us live and also make your comments, make your suggestions, or make even any form of interaction, comments, whatever, you are more than welcome. Also, feel free to share this link with so many people so you can all join us in this great show. This afternoon in London, I'm honored, we are privileged. I'm joined by great people who have done a lot. Their CV is longer than I can never read on air, but it's wonderful to be with them. We have, I just going to give this opportunity to each of them to introduce themselves. So we are going to start with Dr. Josephine Ojambo, joining us all the way from Kenya.
Very much, Julius.
Sorry about that. It happens. It's okay. Carry on.
Happy to be able to join you this afternoon from Nairobi, Kenya. As you've heard, my name is Josephine Ojambo. Thank you, Julius, and it's lovely to see the fellow co-panelists too. All I need to say this afternoon is I am a global ambassador for the London Political Summit. I am a former ambassador of Kenya to the United Nations at New York and former Deputy Secretary General of the Commonwealth. I currently lecture at Kenyatta University in the School of Public Health. Happy to be here today.
Thank you very much. Thank you very much, Dr. Next up, we have Dr. Nina Ritchie. Dr. Nina Ritchie, great to have you with us today. Do you want just to introduce yourself as well?
Good afternoon, and good afternoon to our panelists and the guest viewers. I'm Dr. Nina Ritchie, as you all know. I'm an ambassador for, obviously, a political summit. Also, I am a minister for UK and Europe for League of Arab and Africa, and a Spomuda and other organizations in Jammu and Kashmir. So quite a few organizations I'm part of. I'm spokesperson for women empowerment and youth empowerment. Thank you for having us here for this program.
Great. Next up, we have Dr. Godson Hasu. Dr. Godson Hasu, it's your turn.
Thank you very much, my dear friend Julius Mbaluto, for this wonderful invite. And I want to appreciate fellow guest discussant at this wonderful evening discussion on your program. As you said, my name is Godson Hasu. I'm a political analyst, an author, a writer, publisher, and also at the present time, the summit coordinator for London Political Summits. I'm a community champion. Well, I would say that's what I am at the moment, and I look forward to a wonderful and a lovely discussion this evening.
Well, thank you very much, everybody, and we are great to have you. And of course, our listeners join us, and as we keep on discussing this particular issue. Now, let's talk about our subject today: COVID nationalism. And what is COVID nationalism? You see, when the pandemic kicked off, when coronavirus hit the globe, of course, we never had any answers to how we were to deal with it. But of course, thanks to scientists, we had that wonderful moment where there was a breakthrough and vaccines were produced to help us to contain the spread and, of course, or even cure those who have been infected. But when we look into how things have changed since COVID vaccine was produced or manufactured in different countries, mainly in the Western rich nations. You're talking about US, you're talking about UK, and of course some are being produced in India. But since that production happened, that moment manufacturing happened, when we talk about COVID nationalism, we have a situation whereby the rich nations overpurchased what was to be produced. Now, the dilemma is here, whereby a lot of developing countries weren't given the chance to produce or manufacture these vaccines. These vaccines were being produced mainly by a few big pharmaceutical, global pharmaceuticals based in these rich nations. That's exactly what ended up happening. But Africa, for example, Africa was not given the right also to kind of manufacture of their own. Don't just think that they can't, because Africa's got doctors, Africa's got scientists. Some of the global pharmaceuticals doing this, Africans are working in them. So it wasn't that they could not do it, but the global governance through World Health Organization made it sure, ensure that there was a lot of control to this kind of manufacturing of vaccines. And therefore, it meant Africa now, as a continent, 54 countries, a population of over 1.3 billion, had to depend on what was manufactured by these few global pharmaceuticals. And that being the case now, what we have right now, the situation prevailing is to supply vaccine for COVID in Africa. It goes through United Nations, WHO, and this is COVAX system. This COVAX system is supposed to work into conjunction with the pharmaceuticals. So let's actually bring us to speed before I invite my panelists to delve into these issues. As I'm speaking to you today, Africa as a continent, I think yesterday, but it was confirmed there has been 8.1 million cases of COVID infection. Now, the death toll in Africa as a continent has risen to 206, 202, 206 and 202 people. But recovery rates in Africa has also risen also. Those who have recovered is 7,454,718, which is not bad as well when you look into the recovery rate. But therefore, my question is like, where do we go with this control of the supply of the jabs? Because without supplying Africa jabs, even through COVID mechanism, we find a situation whereby the rich nations are getting well and also their populations are protected. But Africa and other developing countries, nothing is happening. So I don't want to talk a lot when I have a lot of experts, people who have a lot wealth of knowledge on these issues. Let's focus on that alone. The Africa's infection rate, recovery rate, and also death toll. But then let's ask ourselves the question, what can be done to make sure those who are vaccinated, the numbers go up? So I'll start with you, Dr. Josephine Ojambo.
Yes. I missed the last part because I've had some problems with remaining connected. Just pose your question, just the question.
Yeah.
I heard more the introduction.
Okay, no worries at all. The question is that in Africa now, in terms of the numbers of people who are already vaccinated, is about 3% of 1.3 billion people. Let's get the maths right. 3% of 1.3 billion people in Africa have been vaccinated. And what you missed was me introducing what amounts to COVID nationalism, whereby wealthy nations have overpurchased the jobs that are available, leaving less to go to Africa. We have a situation whereby India used to give, India used to export a lot of these jabs to Africa, but because of their condition as India, when the infection rate went so high, they stopped the export. So like Africa now is on the horns of a dilemma. We want to vaccinate our populations, but there are no jabs available right now enough to, do us justice in Africa. So my question is, where do we go with this? Because the numbers of infection in Africa is what I just updated. I've knocked up to 8.1 million as of yesterday in Africa.
Okay, thank you. Yeah, thank you very much. I'll just make a comment on what you started with. But I think that this is a larger discussion when you talk about increasing vaccine coverage than just the jabs. But let's talk about that because that's where you've started. And I think suffice to say that really as the African continent, we are supportive of COVAX. But it's not enough, as the figures tell you. I mean, here we are, 9 months after the first vaccines were given in the global north, and yet in the global south, including Africa, we're still reading 2 to 5% coverage. And another thing is that if you look carefully, you'll find that 70% of vaccinations altogether have occurred in the high-income countries. But even then, in 10 countries alone, do you read 70%? Most of the rest of the globe lies between 5% coverage and that's 70% coverage. So truly speaking, COVAX is good, but it's not enough. The vaccines are not enough, but they're not enough for several reasons. I think if we go into the details, you'll find that even where there has been very large coverage, Israel, for example, where we had a great number. In fact, we reached herd immunity, which is, the over 60% coverage in a short period of time. But in Israel, after achieving herd immunity, 5 months later, we are seeing immunity falling. All right. So again, we may reach herd immunity today. In 5 months' time, what happens? If we follow the Israeli example, we realize that immunity will wane. And on the back of this, we also have the Delta variant, again, being more infective. We also expect that we will learn more about immunity. So there are lots of problems, but you've asked what it is we can do. I think what we need to do is to look at a larger perspective than just vaccines. Yes, we'll continue to work towards achieving herd immunity, but we must look at other principles for attaining the health of our globe. Health is valuable to everybody. We need to put in place other public health measures to ensure that we manage and contain COVID-19. Basic measures like washing your hands, ensuring the message on physical distancing, masking, being sure we can access a working health system. These are important things, but they're also coupled with other elements of the health system, including pandemic leadership, yes, local ownership of the program, community involvement, partnerships with private sector, combining speedy intervention with agility and accountability. Also clear decision-making processes so that we have the same instruction going out, leveraging competencies of our partners. So if one is good at producing vaccine and another at masking, producing masks, how do we bring industry together with different competencies, including young people, so that this whole discussion covers well all populations, especially for us in Africa, including the communities. And more important than that, embracing the digital platform, digital transformation. There's a lot more, and I'm sure we're going to talk about other things, but I think for a beginning, that's a place I'd like to stand on this conversation.
Yeah. You see, of course, I just also want to capture the different situation in different countries. So I'll jump across to Dr. Azu. Dr. Azu, what is the situation in Nigeria, for example, right now, when we talk about where we are or know this global politics of COVID-19 pandemic? Yes.
Can you hear me? Can you hear me now?
Okay.
Can you hear me?
Yes, we can.
Yes, thank you very
Yes, we
much.
can. Carry on.
I do really appreciate the fact that we're discussing something in relation to the politics of vaccine, which is a very significant challenge that we are facing uh, around the world today with regards to the COVID pandemic, which has led to an emergency production of um, a kind of antivirus um, particles that will enable um, the world to overcome the spread and the infection of the coronavirus virus. Obviously, the eminent of such productions has led to kind of a national identity, nationalization of the production and distribution of such products across the world, with most developed countries being the key producing nations of this vaccine around the world, dictating the pace at which the distribution of such vaccines are being handled, irrespective of the um, few intervention of the WHO in trying to make it possible for the producing countries and the financing developed world to take into consideration the impact and the effect of uh, not being able to allow more of these vaccines to be uh, distributed or sent to most of the developing countries around the world, which would, in fact, relate to more contaminations or more infectious rates from the developing countries to the developed countries. And that has been the case. And so we at the London Political Summit are seeing this as an opportunity to continue the discourse on the role of politics of vaccine and vaccine nationalism as a matter of concern with many countries involved in it, because we are looking at post-COVID, and post-COVID can only be very effective and reassuring when every person under the in the on the earth in every country are vaccinated, and we hope that that is the case. At the moment, uh, most of the vaccines are produced in India, and yet India still have one of the lowest vaccinated people in the world. And also India is one of the developing countries, so to say. And if you come to the issue of Nigeria, Nigeria is a typical uh, uh, um, um, case study among many African countries. I know that Nigeria is experiencing the same thing that is experienced in Kenya, in Uganda, in Malawi, in Ghana, though Ghana is doing a little more better than most African countries. But Nigeria today, we have roughly less than about, if I'm not mistaken, about less than 10 million people being vaccinated out of 200 million people in the whole country. And as such, it's not highly encouraging. And that is as a result of the fact that there is still not much of the vaccine being distributed in Nigeria. As at today, we have less than 5 to 6 million doses of the vaccine brought into Nigeria as at the moment, and that there's still a struggle to get as many people vaccinated. But what we're going to be looking at as a matter of importance, as a matter of key discourse, is to bring elements of understanding from various participants, speakers from both the UK and some diasporans and some people that will travel, be able to travel from Africa to attend the events, is to look at how do we face this challenge of politicalization of vaccine production and the nationalism of pandemic in the modern world, 21st century. And that is a case that needs to be taken into consideration, knowing very well that this is the second time we're having a similar scenario. In 2009, during the swine flu, we had the same, almost similar thing when most of the vaccines that were produced at that period were mainly consumed by the developed countries who try to protect their nation, try to protect their citizens, and underestimating the infection and the reinfection of those who are affected with same swine flu in other developing countries. And this is the case at the moment. Now we are having the Delta variant. We are having other mutations that are coming up as a result of people being infected or reinfected in most countries in the developed world, from Africa to Asia, and then transmitting these infections across the open borders or the travel conditions around. And so we hope and look forward to have a better view of this discourse at the London Political Summit coming up soon. And then we hope that there will be a huge advocacy for it for countries such as the US, Britain, the European Union, leverage on making sure that many African countries and Asian countries get enough vaccine to protect their citizens and also enable a global travel safety for many around the world.
And back to Dr. Josephine there. We the world has gone through different pandemics. We even at some point we had HIV/AIDS pandemic that was also global in nature. But when we come to COVID-19 pandemic, we see emergency of COVID or vaccine nationalism, and which actually has taken different dimensions across the world. We've seen the first time they produced AstraZeneca, some countries in Europe, because of the politics of maybe Brexit, some countries said no to that. And of course, different other things happening. So probably maybe you can shed some light to all of us on all this. What does this COVID nationalism or vaccine nationalism look like, in practical terms? How does it look like? What dimension has it taken? And, in reference to Africa as well, how does it even look like? Especially bearing in mind the supply mechanism of the jobs happening right now.
All right. Thank you, Julius. I think, the word vaccine nationalism has two perspectives. Or let me point it this way, not the word, but the phrase vaccine nationalism needs to be looked at from both sides of the table. On the one hand, we're talking about a vaccine manufacturing facility called COVAX, which is largely dominated by big pharma and a few high-income countries. Now, it's this mechanism that's manufacturing the vaccines you hear of, the Pfizer, the Moderna, J&J, AstraZeneca, the Chinese vaccine, and others. This mechanism was put in place in a very rapid manner, supported by WHO, UNICEF, Gavi, and a group called CEPI. And it is responding to the need for vaccine to be globally available. We'll speak a little bit more about how much vaccine has been produced so far. But looking at the issue of nationalism, remember, this was a rapid response to the fact that we realized that we could increase immunity and, based on public health understanding, reach herd immunity quickly enough so that we slow down the spread of COVID. Now, all of this has taken place on a background of fearfulness of people, of communities, of leadership, a feeling of insecurity. Whether we close our borders, we leave them open, take children to school, leave them at home, close down businesses or keep them open. So therefore, any country and any community with its leadership faced with these challenges, in some places it meant early curfew, in others, total lockdown. This fear and insecurity drove nations to close their borders, keeping the people within so that they could be contained and to contain, therefore, the spread of COVID. Those settings and circumstances drive a nationalistic response. So believe me, no matter what side of the table you approach it, all of us became really, let me put it this way, introverted in a nationalistic sense. This is what has caused what we are calling vaccine nationalism, because then when resources were made available, governments and leadership chose to vote or provide those resources to their communities that they were protecting in order that they would protect their national security and sovereignty. What we need to do is to rise from a position where we are speaking of a nationalistic outlook towards making vaccine available to one where countries speak to each other across the globe about the resources they have, with the intention of ensuring that not only do we contain the spread in country, we contain it across borders. Now we need to move from nationalistic responses to multilateral responses. The thing about vaccine nationalism is that, therefore, the high-income countries have the larger resources because Big Pharma actually is funded and exists in high-income countries. And the lower-income countries now on the other side of the table feel that they have to get up with their begging bowls and go to this big vaccine entity to beg, literally beg for vaccine. Because today, like I did say at the beginning, most of the high-income countries can report 70% in some or approaching 70% coverage. But the low-income countries, mine 5%, Nigeria 2 or 3%. So we feel that we are being asked to go with a begging bowl to this COVAX facility. And there is no dignity in that. There is no dignity whatsoever. So for us, we feel that we do want our legitimate share. We are part of the global community. And if we do not stop the spread of this virus in our settings, definitely it's not going to stop spreading in other settings. We want our share, we want our rights. Now, on top of that, we realize that Big Pharma, the people investing, the companies, they want volumes. So they want to sell vaccine to those who have the money to buy. Unfortunately, the money to buy is in the high-income countries. So whereas we might say, Big Pharma, why are you just supplying the US or supplying the UK? The truth is, pharma must exist on money made, on profit. So Big Pharma wanting volumes is giving larger volumes to the high-income countries and giving what you might call surpluses or the profits from sale that they attribute or that they achieve to the low-income countries as part of corporate social responsibility and part of philanthropy. As a result, global targets are not being achieved. In fact, in some countries, whereas in Africa, we haven't yet gotten 2 jabs across the board, in some countries, we are now getting a third, a booster jab. These are the diverse set of circumstances we find ourselves in. But what must we do? We must look at a diverse set of solutions for this very diverse problem. We need to build on what works. There are a number of countries that have put in place effective programs to contain COVID-19. Yes, built on vaccine, but also on other low-cost public health programs with good pandemic leadership. And they've achieved a lot of progress because it's true, it's going to take a long while for us in the global south to attain herd immunity. But while we're doing it, we need to ensure we have good public health systems running that can provide the buttress that we need as we continue to achieve immunity, herd immunity. So in order for that to happen, we are also looking at what we can do to improve manufacturing on the African continent. We're thinking about putting in place more manufacturing capacity. I know there's some capacity in South Africa, but is that capacity serving Africa, or is it serving some African countries and the global north? How long will it take for licensing of lower income countries so they can manufacture vaccine? Again, there's inequity here, but still, even where pharmaceutical innovation works well, it takes quite a while to get licenses. So this again points to wider perspectives in terms of public health programs, so that while we are working at achieving herd immunity, we are building the capacities at community level where we have success stories. And there are lots of success stories, whereas vaccine nationalism sounds really dark and sad. There are lots of success stories that we must build on to give a sense of hope and vision to the global south and to the world at large.
Thank you very much. That clarifies to us, and also, of course, in-depth knowledge, an insight into all this COVID vaccine nationalism. And to you, Dr. Azu, we have our Africa Centers for Disease Control and Prevention. They call it CDC. And of course, working in a different unifying way of the continent's agenda towards how to respond to the pandemic. Despite their efforts so far, despite what has been done so far, we only get reports that Africa has so far received 188 million vaccine doses so far through the COVAX system. We want to remind ourselves, Africa population-wise, 54 countries, population of over 1.3 billion people. And then when you look into the infection rates, as I shared earlier of yesterday, it went up to 8.1 million people infections. So the question to you, Dr. Hazu, is that when you observe Africa Union, when you observe the African agenda, do you think it's working? Is there any more that should be done?
Obviously, Dr. Jambo have said so much about regards to the technicalities and the obvious policy implications or challenges of the way the vaccine is being managed or being distributed on an equitable situation across the globe with regards to both the developed countries and the developing countries, looking at the discourse going on and the various intergovernmental discussions going on with regards to this. It is obvious that the African Union have been doing everything they can to get the WHO and get all concerned governmental agencies and government in terms of state powers to give much consideration in ensuring that the African continent and most especially the Commonwealth nations all have an opportunity to get as much of the vaccines for their nationals. And you could see that at the beginning of the whole crisis, when Donald Trump was in power, he kind of made this global statement about America first, about the trying to drive a protectionist agenda with regards to making this open comment that there are more people infected in America, more people are dying in America, and he needs to do something about it. And so any vaccine that is produced must be meant for Americans first before it goes to anywhere else. And you look at this kind of ideological debate, it also came to be most prevalent in Europe and also in the UK. Wherefore, the UK itself started looking at inward first about protecting the UK nationals, and or even to the extent that they had a kind of a conflict policy agreement with the EU on the production of some of these vaccines by I think it's Pfizer or one of these companies in Belgium, and on how much does the EU have to get, or how much the UK have to get from this particular pharma company based in Belgium then. And also, and then not much was discussed in the early period of this vaccine distribution about the impact of Africans, how the Africans are protected, how the developing countries are protected. And obviously, knowing very well that the WHO did all they can to voice out the negligence, the undervalued position of the African continent in terms of the vaccine distribution, the AU, I believe, should do more with regards to supporting some key African countries that are showing great interest in developing the vaccines in Africa and producing such in Africa, such as like Dr. Jambo said about the South African interest in doing that. Rwandan president was also looking into that issue. And also there's a huge progress being made by the Nigerian government through its drug regulatory agency, NAFDAC, and also the CDC in Nigeria to ensure that there is a headway in giving Nigerian the opportunity to also be competitive in the production of local vaccines in Nigeria and in Africa. And so the most important thing here is about the synergy. It's about the bilateral or the multilateral engagement between the EU and the concerned African countries and the supporting multinational organizations that needs to support such ideas, and also the big income earner countries such as America, Britain, Germany, France, and Russia and China, or the rest of them, to see what they can do to allow or give an enable opportunity for such big pharma companies in South Africa or in Rwanda or in Kenya or in Nigeria to be able to produce some of the local vaccines that will be able to augment what is unable to be transported to Africa from China or from India or from Russia to African continent. And as such, it will give everyone an opportunity to give an equal protection to its citizenry and everyone that is within the country in order to reduce the speed at which the virus is being allowed to spread from one to one, from person to person, even at the point there's still the argument about people being vaccinated still having having that right also to transmit the virus, to someone else. So I still see that the AU have to do more. They have to engage more. The West African Health Organization, I think they call it WAFO or something like that, and the African CDC organization have to keep working more proactively and also engaging with the rest of the globe, because this is not going to be a national agenda. It's a global agenda, and as a global agenda, every country has to play a collective role. There should be a conscious collaboration between all concerned countries, because if, like, at the moment we have the third wave, nobody knows what will happen between now and the winter. If we're going to have a fourth wave, where is the fourth wave going to come from? It could be most of the countries that are yet to be fully vaccinated, and the air travel the air travel condition from most countries that are yet to be fully vaccinated, and then we could have a surge infection or a surge cases of the virus. Here in the UK, there's an increased number of the virus, even with regards to the number of people, almost 40 million or so being vaccinated at the moment, and still yet the government is still concerned with the level of spread. And so the most important thing is the government to be much more concerned with what happens to the countries either in the amber list or in the red list, and begin to see why is it that the number of people being vaccinated in those countries are not increasing, but rather are low, and or are even stagnated because of one reason or the other. And if this reason is that there is no enough jobs for these countries to use, then I think a more effort should be made by countries like UK, Germany, France, US, to ensure that if they have more than enough. I know that America have sent some of their SS Madonna vaccine to Africa. Some of them came to Nigeria. Probably about 4 million of it came to Nigeria or so. I think more countries that are in control of the funding of these productions, such as the UK with the Pfizer production, AstraZeneca, could ensure that the SS productions or the SS jabs that are available should be shipped in form of aids. Rather than giving the Africans money, they should give them vaccine, because vaccine will save more lives. Money will be pocketed by the politicians and never used it to even buy or produce more vaccines for the people. But if the vaccines are made available to many African countries, I am sure that it will help to go a long way to sustain the level of infection and spread the level of the infection being spreading around across Africa, and also the AU to be more proactive, more effective, and obviously the WHO doing what it needs to do. Diplomacy also have to be involved, because we've got the diplomacy, the vaccine diplomacy right now, vaccine production diplomacy. You got India producing the highest number of the vaccine around the world. Now it's about how do India play the diplomacy of delivering these vaccines to some of these countries, irrespective of their own 1.6, 1.3, 1.3, 1.4 billion population. And so there's a lot still has to be done by many of these countries, the WHO, the big players in the global diplomacy, and to ensure that the tests that we are yet to see within the next 3, 4, 5 months of the winter era in Europe and across the Western world do not bring us back to where we started in 2020 March with the virus pandemic.
Yeah, indeed, very, very interesting. There's a point that actually been made. Professor Patrick Ogwang from Uganda is saying that, however, the support is not there. Also, Madagascar had a drug developed which was disqualified by WHO. Dr. Ojambo, what's your take on that? Lack of support for African production efforts.
Question. You know, when we talk about our global health infrastructure, this health infrastructure must be modernized for the health needs of the future. We need a modernized version. And what we mean by modernized, we need a version of global health where Africa comes to the table as an equal partner. The truth is, Africa today has more resources than the global north, has innovation that competes favorably with the global north. For there to be global health and global prosperity, Africa must be at the table. The African Union needs to come up with African-based initiatives for the public good of Africa and for the common good of the globe. These initiatives need to be African-owned, African-driven to promote Africa's good. But on the issue of Mauritius and this innovation, I'm not sure why. But if it is because there wasn't enough pressure at the table to defend and support a good product, this is why I'm saying that we need leadership now in the global health system that is willing not just to chastise and to speak about what's gone wrong, but to now bring to the fore the innovation of Africa, the resources of Africa, the voice of Africa, bringing equity to the African people, whether they're in Africa or in diaspora elsewhere, like yourselves. You want to be part of the discussion. You want to be part of the innovations, and you can drive the agenda. So Africa can manufacture. We know we can. We need to look at big pharma and say, invest in Africa too. We do have the African Union. We also have CDC. We need to have all of these players now focus and refocus on the potentials with Africa. The thing is, India was able to do what it did because it stood up to big pharma. It said, you know, if you're not going to invest, we're still going to go ahead. And India not only has stood up to big pharma, it has stood up to the criticism of the global community. It has manufactured AstraZeneca and it has provided a good quality AstraZeneca to Africa and to other countries of the global south. So in Africa, we also need to stand up. We need to say, yes, we have innovators and they're good. And we need to get going. Whereas we're seeking support from the global north, it's time that we stood up for ourselves and came together to drive innovation of the global south. But I also want to just say, some of the decisions made are not transparent. We're not sure why this vaccine was denied the ability to go forward in terms of perhaps further testing and availability. But this isn't the first time that there's been non-transparent decision-making around the COVID pandemic. There was no transparency when decisions were made to close borders. We were told there was a red, amber, and green list. And we were told that some of us were locked out because we were red listed. But if you looked at the numbers of infections in some of our countries and compared them to the places where these lists were being generated, you'll find that we were far from competing with the numbers on the other side of those borders. We need to deconstruct some of these nationalistic interests that have even driven big pharma to say they are not going to accept innovation from the global south, such as that from Mauritius. There has been no transparency in how decisions were made. Borders were closed even within China, Yet borders should have been closed from China going outward in the early days of this pandemic. Yet there was no recourse given. Nobody said close them and close them early. So some of the issues around travel too need introspection. We need to be able to, as a global community, look at global health threats and put in place pandemic preparedness before the event, not when we have the event, we're thinking about, okay, let's put in some preparedness, but already we have a virus that has spread globally. We need to be able to monitor global health threats and put in place pandemic preparedness. I'd like to speak about the analogy, or what I mean by global health threats. We know that there is a global center supported by CDC in Bonn. We're not really sure now how this center is going to shape global decision-making, whether it's informing all heads of government, and whether what comes out of it will be large enough to change leadership globally, or will it be about blaming some countries and some individuals? We need an infrastructure in place that is global to manage global health threats, to manage even manufacturing. That's what we don't have in Africa. We don't have yet the infrastructure to set up large-scale manufacturing. So another issue is infrastructure, whether it's infrastructure for global security and health threats or infrastructure for vaccine production. We need to build this infrastructure quickly. When I speak about global health threats in Africa, I look at the analogy of the National Security Council in my country or the Security Council at the United Nations. What happens when there's a threat? The heads come together, and together in a multi-sectoral manner, they think about, what do I do in my sector? How can we work together? How can we protect ourselves by putting in place as quickly as possible responses? We didn't have a global health threat council or infrastructure working when we heard about the pandemic. In the beginning and even now, we still don't have it. This needs to happen. We need this infrastructure, this architecture in place, a global architecture for national health threats and global health threats, an infrastructure that can respond. So that, like, we would have boots on the ground when a border suffers incursion. We would have the best of the health sector working with other related sectors when there is the need to respond to a pandemic. And this needs to happen soon. It can be linked to the Security Council. It could be a committee of the council, or it could be a freestanding health security council, health threats, global health threat security council. But it needs to be put in place so that in the future, we are not falling on our swords, as it were, with the next pandemic. Thank you.
Thank you very much, Dr. Jospin. And of course, when we look into the Africa continent, what we could now term as the medical infrastructure is kind of, in a way, wanting. It's kind of, in a way, not quite there yet. Yet when you look into all these the nature of the COVID-19 pandemic jobs. Some of them were supposed to be distributed within very delicate infrastructure, which was like kind of a challenge. Like, for example, the temperatures being extremely low and all that. So what do we think, for example, Dr. Godson, what do you think we should be doing within our, continent to improve the medical infrastructure? So like a pandemic like this, if you were to talk about extreme low temperatures and distribution, then we say it's from the flights to the hospitals and nothing will go wrong.
Yeah, thank you very much. I think listening to Dr. Josephine Ojiambo, she has made a very strong, like I said earlier on, technical and expertise and explanation on the situations as with regards to the conditionalities that are ongoing with regards to the COVID scenario in many developing countries and the production of the interventionist COVID vaccine protocols and the way it's being distributed among many concerned countries globally, and most essentially to the less developed countries in Africa, and the role in which many African countries are supposed to be playing to secure such vaccine distributions or delivery in their country, and the role that the AU and ECOWAS and the South African body of countries in South African sub-regional bodies, organizations have to play in ensuring that the countries within their sub-regions and the entire continent in are involved proactively in ensuring the most enabling protective condition for those vaccines. Like you said earlier on, some of these vaccines has to be stored under a particular temperature for it to stay for a while as the jab is being run through as many of the population. And remember that most of these populations live in remote areas, in villages that are very difficult to navigate, and you need to make sure that the preservation of these vaccines are done under the specified conditions or temperatures in order to be able to reach to these remote areas, remote hinterlands in Africa. And for this, like Dr. Jampo said earlier on, provision of infrastructures. There are a lot of African countries lack health infrastructures. They lack social infrastructures, most especially social infrastructure, because there are so many countries that doesn't have that cannot generate power supply in terms of electricity on a 24-hour basis in their country as at this present 21st century, which is a very, very disappointing situation in many of such countries. And Nigeria is not left out. Nigeria is a huge country. The biggest black populated country in the whole world, and at the moment cannot generate beyond 5,000 megawatts of electricity for a population of over 200 million people. Is very challenging at this condition to be able to guarantee the preservation of many of these vaccines that needs to be preserved under a zero temperature also for it to be able to circulate all the population during the period of during the period of the vaccinating the population that needs to be vaccinated. And as such, there is need for many African countries, such as Nigeria, take a good note from the situations that the pandemic has created by working hard at every policy levels to ensure that one critical areas that they need to invest more in now for the next 5-10 years national planning period is to begin to work on how to enhance and improve on their social infrastructural development, such as making sure that the country is able to generate an average in a country of such capacity, an oil producing country, one of the greatest gas producing country in the world, should be able to be generating at most, if nothing else, 40-45% power generation, which ensures that at least between 100 and 150 million of its population can live with full power sustainability round the clock, 365 days of the year. But that is not the case. And also, when you don't have power, it is difficult to maintain healthcare centers. It's difficult to maintain healthcare centers. Nigeria has one of the poorest healthcare centers structures in the whole of Africa because a country of that population with a doctor to with one doctor to about 10,000 patients is incredible, is ridiculous because Nigeria today has only about 35,000 functional medical doctors, practitioners in Nigeria to a population of 200 and something million people. And we have it is expected that the 774 local governments in Nigeria should have at least one health center each. But that's not the case. Nigeria doesn't have that kind of infrastructure in place. So it's a challenge. And it's also like that in many African countries, notwithstanding. I don't know, but I believe Kenya is experiencing such things. And Dr. Jambo is from Kenya. She is an experienced public health practitioner in Kenya. I know people in Uganda are suffering such things. I know people in Tanzania having such challenges.
Yeah.
People
Yeah.
in Benin Republic and Togo are having it. But then a country must lead the way. We need a country. And if Nigeria, as one of the most populous countries in Africa, the giant of Africa, they said, and one of the biggest economy in Africa, is not able to lead the way in a proactive way in ensuring that certain such infrastructures are put in place now for the next 5, 10 years
Yeah.
in order to assure that the next pandemic, because pandemic will always come. Every decade there is one new pandemic that arises on Earth, and so are people using this as a template to learn from what happened during the SARS, during the swine flu, and now coronavirus. Learn anything to ensure that they put in place
Yeah.
certain basic infrastructures that will enable them to encounter
Okay.
to face the challenges of any pandemic in the next 10 years to come.
Yeah, thank you for that. Thank you for that. I think you're calling upon leadership across Africa. Think of investing to make medical infrastructure better. Think of good governance. Earlier on, there was another comment from Joseph talking about, when we talk about pharmaceuticals, when we talk about healthcare, it has become a big global business, and therefore we need less corrupt people in these places, and also less corrupt people in governance, not just Africa, globally, even US. Talk about UK, talk about ethical ways in the medical, fraternity that ensures that human life, or human life precedes or overrides any other business consideration. I think that's a very key thing. And that also goes to touch on, of course, Africa as well, what we have seen in different countries, corruption happening. COVID millionaires, different other countries calling them different names. And that's a tragedy. No one should be making money out of people dying. It's totally uncalled for, and I just quickly want to give, as time is running out of our hand, I want to give Dr. Ojambo, a quick minute to say the last word in terms of also this international setup of travel and what has actually been duped, COVID apartheid, and it's all these colors that don't make sense because in terms of travel, we have seen everyone vaccinated in Africa, for example. The medication came from the Western countries. So how come then when you want to travel from those countries to UK, for example, or any other country, how come then they say they do not recognize your vaccination in Africa? It's their medication.
Yes, this is where I said earlier that countries such as India, which gave us in Africa the AstraZeneca vaccine, stood up to Big Pharma and said, okay, if you don't give us the tools, we still have the vaccine manufacturing capacity. We'll go ahead and manufacture vaccine because we need to protect our nationals. And they stood up to Big Pharma. And initially, they were sending out lots of vaccine to other member states in the global south, but had to call back that goodwill because they had to deal with their internal crisis. The numbers of figures were rising. But as a result, because we are talking about big pharma that wants big money, and India was being very philanthropic and is still very philanthropic and supportive of other member states in the global south. So today the borders are open, but we hear that if you travel, you're considered as or treated like someone who didn't have a vaccination at all if you come from the global south. You're discrediting the manufacturing capacity of India and other countries in the global south that have come together to protect the nationals in various countries in the global south. But that's why I said earlier, we need to come together so that Africa presents itself at the table with other members of the communities of nations of the global south as one united, strong voice with the ability to innovate, with the capacity to produce, and with a right to be at the table. We are part of the global community. We have a right to be at the table. That's the only way our voice will be heard. And so travel has been unfair. This green, yellow, and red list wasn't transparent. It was driven by nationalistic interest. But like I've said, there's been no transparency anyway in how decisions were made. So what we're looking for now is a leadership for the future, a leadership that's going to be accountable to its citizenry and looking at, able to look at public health as a common good, as a public good for its citizens. We need a leadership that's going to manage well the security of its internal communities as well as security across the borders. We need capable global health systems. And as we have spoken about the issues of cold chain, we have so many lessons learned from polio as one of those viral diseases that the world is slowly seeing eradicated. What did we learn about cold chain? We learned about the use of solar. We learned about the use in communities of small vaccine boxes carried on bicycles to deliver vaccine. These innovations need to be brought back to the table. We have capable health systems. We just need to strengthen them and do what we call sharing of best practice so that we have capable global health systems for our future. We need to have common goals as a global community. The common goal here being the eradication of COVID-19. It must be common. We're not going to say we reach 70% in the global north and the global south can keep trailing behind us with 5%. We need a common goal. And therefore, with the common goal, we'll have a common solution. We need to therefore bring the countries and partners together to create joint solutions to strengthen global health security. We need multi-sector responses, building the link now between the human population of this globe and the populations of animals and other life, including plant life, because we have found that the pandemics of the future may be generated from what we call zoonosis, or animals or animal-based infections spread to human beings. So we therefore need a multi-sector response, and a response that's driven by evidence, scientific evidence, not out of fear, not out of nationalism, not out of friendships that are transient, politically based, but based out of evidence that respond to global health threats and are prepared by monitoring global health risks. Because, like you said, health is valuable. Health means everyone's health is valued, and everyone's contribution is valuable to global health.
Thank you. Yeah, thank you very much, Dr. Ojambo, Josephine Ojambo, connecting with us all the way from Nairobi. Thank you very much, Dr. Godson Hassel, here with us in London, and thank you for your contribution. Unfortunately, Dr. Nina Ritchie couldn't connect properly, so she left, but again, thank you for a brief contribution. To our viewers, thank you for joining us wherever you are in this part of the globe. We are happy for you being with us. So that's all we have today for you. And of course, keep tuned for more programs. Join us next week for more on Julius Mbaluto Live. I'm your host, and of course, Julius Mbaluto, and we say goodbye from wherever you are. Thanks for being with us. It's been a pleasure.
Thank you. Thank you.